Hey, what's up? How's it going? It's Gabriel again, coming at you 2 weeks now post meniscus surgery. I just returned from the surgeon's office where the surgeon told me that he took out a third of my medial meniscus, which means it's going to be a lot less cushioning and support. And certainly over the last couple weeks, I've noticed a lot less support. It's just a little bit, the stability is just not quite there. It's doing pretty good. I can move around, I can support weight. I haven't done any kneeling or anything like that, but I can tell sometimes it wavers and wants to give. One thing I have been using is this, so now I've upgraded. I used to have a wrap, but now I'm going with this device, which is just a neoprene knee brace. Like I said, the stability is just not quite there. I don't want to rely on the knee brace, but when it goes above and beyond what I'm comfortable with now, still just 2 weeks out, I'm just going to go ahead and go with the brace. So what I'm going to do now is I'm going to do some yoga therapy movements that I've learned here at Fierce Heart Studio. And what I can feel is it is stiff, but I can move it. I can move it pretty good. I'm surprised myself. Slow. Mostly the reason why I'm doing this is because it's different, right? Because it's fun and because I can just engage different kind of movements that I usually get. And I think this is a real lesson we can learn as therapists, as people prescribing movement. You know, you're going to prescribe 10 of this, 10 of this, 10 of this, and they get 5 moves, and they go home and they're supposed to do these 5 moves for the next umpteen days, and it's like that gets really boring. What we need is a diversity of movements. So just experimenting with trying to put some weight down while the knee is in a flexed position. So just trying to get my knee used to putting some weight on it. This is a little bit too close, so I'm going to move out just as far as I need to be. I'm going to relax my hip flexors and really the quads as much as possible. Try to use the backs of my legs to push down to the ground. I'm going to try not to tilt, so I'm just going to feel the angle between my pelvis and my ribs, and I'm just going to try to keep that same angle as I lift up. A lot of people will rotate up. The knee is super comfortable. It's not talking to me at all right now. So what I'm trying to do is just do diversity of movements and try and just have fun with it, and that way, because I can have fun with it, I can keep doing it day to day. If it's a chore, you're not going to do it. So what the solution is to find a way to make it fun. One way to make it fun is to find something you like to do. Another way to make it fun is to find just a variety of movements, to try a bunch of different things. And then again, just ask therapists or ask people recommending exercises, whether it be a massage therapist or fascia release or a kinesiologist, is to consider that the people that we're leaving are probably not going to keep doing exactly what's prescribed if it's monotonous, if they really don't like to do it. So finding things that people like to do. Right now I'm going to do that with some yoga therapy. I'm going to take these chip foam blocks and put them under where my knees would be, so that my knee doesn't have to go on the ground. And I'm not even going to rest my knee really down. I'm just going to put a little bit of weight on it, and then I'm going to push up. Try to take a little bit of weight off it. Push into the hands, hover. So going back really as far as I can go, I feel like I can put weight on it, so I'm going back, putting weight. And again, working the backs, pushing the mat away, working the back of my leg. Trying to keep my hips as quiet as possible here. switch. Good. And that's starting to feel like enough, so I'm just going to let that be enough. And I'm getting a little bit of stretch to this one. Try and keep the knee straight, pushing these hips into the ground. Push with the back of the foot, nice and quiet hips. So this is also good, giving me a little bit of stretch in the quad, which can get really tight, so we're doing a lot of exercise for it, biking. Good, doing the other side. So now this knee is getting used to bending under load and straightening under load. Okay, so there you go. So that's how it is. That's my practice for today. Feeling okay, it's starting to be a little bit sore. Still not really super good with putting weight on it flex. I feel there is that during the bridges, during the lunges and things like that, bending the knee while it was under load was difficult. So I need to just keep increasing that load slowly. Anything that there's friction or I'm feeling something wiggling, I'm just going to do a little bit less, and I'm going to keep getting used to it, and I'm going to keep doing that muscle building and the joint strengthening. The muscles are one avenue of what I'm trying to do in terms of rehabbing it or increasing the stability. You need to develop the muscles around the knee, that's for sure, that's number one. Number two is the joint capsule itself. So the joint capsule has been perforated, which means the internal pressure has been really reduced. So as that joint heals, I want to make sure to keep a lot of fluid flowing in. And so biking has a lot to do with that. So biking has a lot to do with, building the muscles as well as clearing a lot of the inflammation because it's moving fluid through the knee. The surgeon did also say he felt that it should be a real turnaround injury for me. He totally understood the need to have the surgery and what it must have been like for the last couple of years, and said now that the surgery has been done, I should be able to get back to normal life pretty good. And I'm going to keep it playful, and I'm just going to keep doing what keeps me moving it. So I'm just going to keep doing what I like to do with it. Let me know what you think of these videos. Let me know if you have any other ideas or cool stuff that you'd like to see in the future. As I get better, I'm going to look towards shifting this to something else that's cool and interesting. So let me know if you have any ideas or if you'd like to get involved or what you think. Thanks a lot, and I'll see you in a couple weeks. Keep it playful, keep it fun. Peace.